Good morning, Dr. Broom. My name's Lindsay. I'm going to be your nurse today, performing your complete head-to-toe assessment.
Good morning.
How are you doing this morning?
I'm well, thanks.
Good. The first thing I'm going to do is just wash my hands, make sure my hands are all clean, and then can you just tell me your name and date of birth?
Sure, it's Brantley Broom, and my date of birth is 3/24/76.
Okay, great. And do you have any allergies?
I don't.
Okay. Can you tell me what today's date is?
It's December 17th.
Okay, wonderful. And where are you today?
I'm in the JU Skills Lab.
All right. And who's the President of the United States?
Barack Obama.
Okay, great. And what season is it?
It's Christmas season. It's almost winter.
It's almost winter.
Yeah.
Perfect. Okay, great. So then I'm just going to move into your physical exam, okay? And if at any time you have any questions, just let me know.
Okay.
Okay? All right, the first thing I'm going to do is just inspect your head. I'm looking for symmetry, looking for any masses, abnormalities, anything that may be asymmetric, and then I'm going to palpate your head. Good. And do you have any tenderness?
I don't.
Okay, good. I'm going to inspect your face and looking for symmetry, and at the same time, I'm going to be checking cranial nerve 7. So can you go ahead and smile for me? Good. And frown, and puff out your cheeks. Good. And raise your eyebrows. Good. Wonderful. So everything is symmetric there and even, and everything moved when I was checking that cranial nerve, so that was perfect. So then I'm going to palpate your temporal artery. Good. And I'm going to move down and I'm going to palpate your TMJ. And go ahead and open and close your mouth for me. Great. Okay, and that tests the motor function of the trigeminal nerve. And now I'm going to test the sensory. Tell me when you feel this.
Now. Now. Now.
Very good.
Now. Now. Now.
And that's cranial nerve 5, motor and sensory. That's a mixed nerve. Okay? All right, and now I'm going to move down and I'm going to palpate your sinuses. These are your frontal sinuses and your maxillary sinuses. Any pain or tenderness?
No.
Okay, good. Very good. Now I'm going to test your corneal light reflex. Okay, so I'm going to move into testing your eyes. All right, and I'm just going to shine this light right over the bridge of your nose, and you can just look straight ahead at me, okay? And I'm looking for even displacement within your pupils. Great, and now I'm going to check your pupillary light reflex. And I'm checking direct and consensual. Direct and consensual. Okay, great. Now, can you just keep your face still and move just your eyes and follow my pen light with your eyes, okay? All right. Great, and now I'm going to test for accommodation, so go ahead and look over my shoulder at a distant object, and now focus on my pen light. Very good. And that tested for cranial nerves 3, 4, and 6. Okay. And now I'm going to test your vision. And if I was doing distant vision, I would use the Snellen chart, but I'm going to use the Jaeger card. Okay. All right. So just hold that about 14 inches from your face. Cover one eye, and tell me which line you can read. Read the lowest line that you can read.
42639.
Great. And switch.
426,739.
Great. And both.
426,739.
Awesome. Okay, and that tested cranial nerve 2 as well. And now I'm going to test your. I'm going to do the confrontation test. So if you will cover your right eye, and I'm going to cover my left eye, and tell me when you can see my hands.
Okay. Now. Now. Now.
Okay, and switch.
Now. Now. Now.
Great. That was perfect. I'm going to put gloves on and I'm just going to inspect the internal structures of your eyes, okay? Just looking at your conjunctiva. Your eyelashes are even. I don't see any lesions on the outside lids. Your eyelids are both symmetric. I'm just going to pull your eyes down. Very good. Very good. Okay. And no pain in your eyes or anything? Okay, great. And now I'm just going to test and inspect your ears. Okay? So I'm going to inspect the outer structure of your ears, which is the auricle, the tragus, and I'm going to palpate. Good. No pain? Good. And now I'm going to perform the whisper test.
Okay.
And this is also going to test the auditory nerve.
Okay.
Okay, go ahead and cover your right ear and move your finger in and out. And I'm going to whisper 3 unrelated words and repeat those back to me, okay?
Okay.
Car,
Car.
salad,
Salad.
dolphin.
Dolphin.
Very good. And go ahead and switch with me. Salad,
Salad.
dolphin,
Dolphin.
car.
Car.
Very good. Okay. Do you have any questions so far?
I don't.
Okay, great. Now I'm going to move on to your nose.
Okay.
And I'm just making sure that it is symmetric. And while we check for patency, I'm also going to check cranial nerve 1.
Okay.
Okay, so go ahead and close your eyes for me. And go ahead and breathe in. Great. Okay, now I'm going to put an item up to your nose, and I want you to tell me what you smell, okay? Go ahead.
Cinnamon.
Very good. Okay, and go ahead and breathe in with, cover your other nostril and breathe in. Good. Okay. And again.
Alcohol.
Very good. Okay, that's strong. Very good. That's cranial nerve 1. Okay, and I'm going to inspect the inner structures of your nose. Very good. Okay, and now I'm going to move down to your mouth. Okay, all right. I'm going to just inspect first, and then I will palpate the inner structures. Okay. Brush gloves. Go ahead and open for me. I'm looking at your buccal mucosa, your teeth, your soft and hard palate. Everything is nice and aligned. Okay, go ahead and open for me again. Good, and no tenderness or pain when I'm palpating? Good, all right. And now I'm gonna just check a few more cranial nerves while we're looking at your mouth. So if you could go ahead and open and stick out your tongue and say ah. And the uvula rises to midline. I do not see any tonsils, so I grade those at a 0. And at this time, I would check your vagus nerve and I would check your gag reflex.
Okay.
Okay. Can you stick out your tongue for me and move it side to side? Great. And say light, tight, dynamite.
Light, tight, dynamite.
Great. So I just checked your glossopharyngeal, your hypoglossal, and your vagus nerve.
Okay.
Okay. And now I'm going to move into, and I'm going to palpate your lymph nodes.
Okay.
Okay. Good. And shrug your shoulders for me. Very good. Good. So I'm going to inspect your neck, and I'm looking for any masses, any lumps, any pulsations, and I don't see any abnormalities with that. So I'm going to check your range of motion with your neck. And first, I'm just going to have you do it passively. So can you take your chin to your chest? Great. And back. Good. And side to side. Very good. And ear to shoulder, ear to shoulder. Very good. And now I'm going to test it against strength, okay? So go ahead and push your, good. And back, and side, good, side, good. And go ahead and shrug your shoulders for me. Very good. And that tests cranial nerve 11, okay, spinal accessory. Very good. Now I'm going to just palpate your trachea. And I'm also going to palpate the carotid artery while I'm here, okay? Good. Now I'm going to move behind you and I'm going to palpate your thyroid, okay? And go ahead and tilt your head to the right and swallow. Very good. and to the left, and swallow. Very good. Okay. And while I'm doing that, I'm going to auscultate the thyroid for bruits and the carotid artery, okay? And I'm making sure I'm using the bell. And I'm going to do your thyroid first. Very good. And now I'm going to auscultate your carotid artery. So if you could take a deep breath in and hold it for me. Good. And exhale. Okay. And one more. Very good. Now I'm going to move on to your lung exam. Okay. I'm going to have you tilt your legs this way.
Okay.
And I'll primarily be working on your posterior chest, okay? So I'm looking at your chest and I'm inspecting it for any accessory muscle use, any irregularities. I'm looking at your rate and your rhythm of your breath sounds. And at this time, I would take your respiratory rate. And your rate is normal, and your rate is 12, okay? So after I inspect your posterior chest, I'm going to just palpate, okay? So I'm just going to be touching you. Good. And now I'm just going to check for equal chest expansion. So when I ask you, we go ahead and take a deep breath. Very good. Okay. And at this time, I'm going to check for CVA tenderness. Okay. So I'm just going to lightly tap on the back of your back. Does that hurt?
Yep.
Okay. Any pain there?
Like that.
Okay, great. Now I'm just going to percuss. Okay.
Okay.
Very good. And now I'm just going to be auscultating your back.
Okay.
Utilizing the diaphragm of the stethoscope, okay? And take a deep breath in for me. Very good. And again. Very good. And I would continue those deep breaths on a normal patient, but go ahead and you can breathe normally for me. Okay, very good. The last thing I'm going to do in your lung exam is I'm going to test for tactile fremitus. Okay, and I'm going to do this by placing my finger on your back, or my hand on your back, and asking you to say 99.
Okay.
Go ahead, say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Very good. Okay, and you can go ahead and face me. And now I'm going to be moving on to your cardiovascular exam, okay? And while I'm looking at your chest and I'm looking for any pulsations or heaves or abnormalities, I'm looking at the symmetry of your shoulders as well. And I'm checking your precordium. I don't see any heaves. I don't see any pulsations that I can see with my eyes. So I'm going to palpate your precordium, okay? So I'm just going to touch you. Very good. And now I'm going to palpate your apical pulse, okay? So I'm just going to need to touch right over here. Very good. Okay, and now I am going to auscultate, okay? First with the diaphragm, and then I'll be auscultating with the bell.
Okay.
Very good. Now I want to look at your coloring, and I just want to make sure that everything is evenly distributed. And I'm going to check your fingers for clubbing, and I'm also going to check your capillary refill. Very good. Okay. Now I'm going to have you lay down.
Okay.
And if you could, turn your head to your left, and I'm going to check you for JVD. Excellent. And while you're lying down, I'm going to check some of your pulses, okay? All right. So the first I'm going to check your radial and ulnar pulses. Very good. I'm going to check your brachial pulses. Okay. I'm going to check your femoral pulses, so I'm just going to touch right here, okay?
Okay.
Very good. I'm going to check your popliteal. Very good. And do you mind if I slip your shoes off?
Sure.
Okay. Then I'm going to take your socks off as well, okay? So I want to check your dorsalis pedis. And posterior tibialis. Very good. And while I'm down here, I'm looking at your bilateral lower extremities, and I'm looking for your hair distribution, any varicose veins, any abnormalities that I might see down here on your lower extremities. And now I'm just going to, and particularly any edema that I might see on those lower extremities. So now I'm going to move into your abdominal exam. Okay? So the first thing I'm going to do is just inspect for the contour, the shape, any pulsations, any heaves that I might see, looking at your umbilicus, and making sure that everything is symmetric and even. Okay? And after I inspect, I'm going to auscultate. Okay? So I'm going to auscultate for bowel sounds. With the diaphragm, ensuring to auscultate in all four quadrants, okay? Very good. And then I'm going to auscultate for with my bell to at the vascular sounds. Very good. Okay, and now I'm just going to percuss. Very good. And now I'm just going to do some palpation, okay? I'm going to start with light palpation. And then deep palpation. Very good. All right, the next thing I'm going to do is check for rebound tenderness. So I'm just going to press on your left lower quadrant and tell me if you feel any pain when I release.
Okay.
Okay?
Nope.
Okay.
Nope.
Okay, great. The next thing I'm going to perform is the Murphy's test. Go ahead and take a deep breath for me and breathe out. Good. Any pain there?
No.
Okay. While you're lying down, I'm just going to finish checking a few more lymph nodes. I'm going to check your axillary nodes. Good. And your epitrochial. And your inguinal. Very good. Okay, you can go ahead and sit up for me. All right. The next thing I'm going to have you do is a couple movements with your arms, okay? And this is just going to test for cerebellar function, okay? The first thing is going to be rapid alternating movements.
Okay.
So if you can take your hands like this. Very good. All right, and then I'd like you to reach your hands out and close your eyes. And one at a time, alternating, bring your finger to your nose and then back out again. Very good. Okay. Now I'm going to move my finger at different locations, and I'd like you to touch your nose and then touch my finger.
Okay.
And then back to your nose and then move your finger to my finger, okay?
Okay.
All right? Very good. Very good. Very good. And now I want you to close your eyes, and I am going to touch an area on your body and name that area for me, okay? All right.
Arm. Knee. Arm. Face.
Very good. Okay, we're moving into the last portion of the final head-to-toe assessment, okay? And the last thing that I'd like you to do is going to be your musculoskeletal exam.
Okay.
So if you could go ahead and stand up for me. And the first thing I'm going to look at is your gait, okay? So if you could walk right over here to that orange line, just normally. Very good. And turn around and walk back on your toes. Okay. And then I'm going to have you walk back on your heels and then walk back normally. Very good. All right. And if you could just stay standing for me, I'm going to palpate all of your muscle groups, okay? Testing for symmetry, testing for muscle. Very good. And now I'm going to have you perform some range of motion for me, okay? So we're going to look at your shoulders, your arms, your legs, and your hands, okay? We've already done range of motion on your neck.
Okay.
All right. So if you could just follow me and do what I do, okay? All right. Arms up. Very good. Arms down. Very good. Arms up. Very good. Arms down. Backwards. Very good. And now take your hands out. Out. In. Up. Back. Side to side with your wrists. Very good. And now with your legs, I would like you to bring your legs up. Good. Good. And down. And out. Good. And up. Good. And out. Good. And across. Good. And across. Good. And if you can bring your foot up and dorsiflex, plantar flex. Good. Dorsiflex, plantar flex. Very good. Now I'm going to have you sit down. I'm going to have you do these same movements, and I'm going to be applying resistance, okay? All right. So go ahead and lift your arms for me. Good. And lower them. Very good. And let's do your wrists, okay? Up and down and out and in. Very good. And I want to palpate your hands. Very good. And I'm going to have you close your fingers. Good. And open them. Very good. Okay. And then let's do this. All right. Push out. Good. And push down. Good. And up. Good. And up. Good. And go ahead and lay down for me. Good. There we go. All right. I'm going to have you lift your leg for me. Good. And push down. Good. And push up. Good. And push down. Good. And go ahead and push your feet against me. Good. And pull back. Good. Now this time I'm going to check for Babinski. Very good. I'm also going to check Homensign. Any pain there? And I'm going to check for clonus. Bring your leg up. Very good. Very good. Go ahead and sit up for me. During that musculoskeletal exam, we demonstrated abduction, we demonstrated flexion, we demonstrated dorsiflexion and plantar flexion, and we just have one more thing to demonstrate, and that's pronation and supination. Okay? And we did do that, I just didn't point it out. So pronation and supination, we also did this while we did rapid alternating movements. Okay? That concludes our final head-to-toe assessment. And do you have any questions?
I don't.
Okay, I'm just going to wash my hands and record my findings.
Okay.
Thank you so much.
Thank you.
All right.